If you suffer from sciatic pain, or if you know someone who does, I'm going to show you something that can be absolutely miraculous. Frequently, I like to do a video on this technique because it's so amazing and it's so simple to do, and I offer it to humanity at no charge. I call it the Curtis technique. You can call it whatever you want. But the way you do it is you find, and you're going to be doing it on both sides, but especially on the affected side. So let's say you have sciatica on this side, or even low back pain. And there are other nerves aside from the sciatic nerves that go down the legs. They will all respond most of the time to the Curtis technique. I would say the technique is effective at least 90% of the time, probably more. So the odds are in your favor. It's very simple to do. Some people ask me to draw a diagram. You shouldn't need a diagram. I'm going to explain it. It's very simple. Find the center of the armpit and then go down about a hand's width and then dig in with your fingertips. Or you can use the thumb on the affected side. If you're doing it on someone else, you can use the fingers of both hands. But you're going to find the sorest spot, and that is your guide, the sore spot. Poke around until you find the very sorest spot. And if you have sciatica, it's going to be sore. It's going to be there. And if you can't find it, go a little further forward, a little further back, a little further up, a little further down, until you find that spot, and then dig in for about 30 seconds. Make it hurt, move it around. Now, if you suffer from this problem, do it several times a day, even if you're not having the pain at the time. And if you're having the pain, in most cases, it will make it go away. In many, many cases, I've seen permanent results with this. And I don't care if you have disc herniation or bulging or protruding disc. I don't care what it is. It usually responds to the Curtis technique. So give it a try and good luck. Also, I'm going to ask your help in spreading the word about this. I have never charged for the Curtis technique. I don't make any money on it. I've made, I don't know how many videos on the technique explaining how to do it. So if you know someone who has a low back condition or have some kind of neurological problem radiating from the low back, particularly sciatic neuralgia, teach them this technique. You can even do it on them. And be persistent. If it doesn't seem to work, if you can't seem to find the point, dig around, keep pressing. If you have sciatic neuralgia, that painful spot is going to be there. People often ask me, what does this have to do with my low back, with my sciatic pain? And I tell them, in order to understand that, you have to understand fascia. A lot of people think this is an acupuncture point. I don't believe so. I believe it is related to the fascia.